I would definitely say magic happens on our labor floor every day. It's amazing the sorts of things that we can accomplish on our floor.
When I walked on the labor and delivery floor, I just felt like I belonged in a way that I hadn't in any other hospital. This felt like a home, it felt like a family.
When I was in medical school and I did my different rotations, the field of anesthesiology opened up many, many doors. You can work in an operating room, you can work on an obstetric floor, you can work in pain management, you can be a great clinician and at the same time do a lot of research. Obstetric anesthesiology really brought this all to life.
Fellows serve as a unique role between the faculty and the residents, in which you have a new level of autonomy that you never got during residency. But at the same time, you're under supervision, under tutelage of trained people who can further your aspirations. It's going to be an incredible growth experience for you, and we're just very excited to help you along that path.
Imagine a fellowship where not only do you get great clinical training, but you gain a second family. That's the kind of environment that we have here.
You're going to be part of an incredible team of obstetricians, nurses, and pediatricians who are all caring for this person, this patient who needs your help right now.
They're going to remember the birth of their child forever, and you can make that moment even better or extra special.
I think this program prepares you for a lot more than just to be a doctor. You'll be a healer and a teacher too.
This is their year. This is their year of exploration, and we want them to gain as much as they can out of the year.
You can really chart your own adventure and build a fellowship around you.
From day one, you will become part of the obstetric anesthesiology team and a part of the obstetric team as well.
From day one, you will be challenged, but in a great way.
You will be able to not only provide direct patient care, but communicate with patients as well as their families.
From day one, our fellows are treated as junior attendings. And so they are expected to be able to help us to manage the floor and manage the education of the residents.
You're going to become a key member in the bridge between the anesthesiologist and the obstetricians.
You'll be pushed to collaborate with attendings in other departments and be a point person for big cases.
The first few days may seem like a whirlwind. We're going to have patients coming from left, right, and center. You're going to have obstetricians coming and telling you things, pediatricians, nurses, all maybe pulling you in different directions. But after a short time, you're going to realize the reason they're coming to you is because they have an expectation of your abilities, and you will rise to the occasion.
The reality is we need our fellows. I don't know what we would do without our fellows. They're such an integral part, and it's great having them around.
During the year, our fellows will learn to master all of the clinical skills needed to care for the obstetric patient.
The volume of cases, the diversity of cases, to have the ability to conduct research, and that may be clinical research or basic science research, to have mentorship. Mount Sinai offers all of that.
At Mount Sinai, we do about 8,000 deliveries per year. We see more complex cases that fellows would want to see.
There's multiple giants in the field, and we see very advanced clinical cases, and sometimes we see things that they're not even described in the book.
It's not uncommon for us to see patients with medical comorbidities of pretty much every organ system. Patients with neurologic disorders like multiple sclerosis, patients who have inborn errors of metabolism, patients with lipopolysaccharidosis or issues with glycogen storage diseases.
You sometimes need to take care of patients with complicated social or historical backgrounds. You want to take care of different patients from different types of populations. All of this will help you become a well-rounded physician so you can really become a leader in your field.
There's specific rotations that we'll do, which is maternal fetal medicine, that you do for 2 weeks.
And then we also do a couple weeks in blood bank. So we learn about the process of typing blood and preparing blood for emergency bleeding protocols that we do encounter on OB.
You spend time in the NICU for 2 weeks. You do a fetal heart rate monitoring course and learn about neonatal resuscitation and how to actually be that point person for neonatal resuscitation.
My goal is to be there for you during the workday, but also beyond your year as a fellow to help you through your future experiences.
The Mount Sinai name carries amazing weight. And when they finish here, the doors will open for them almost at any institution they want to go to.
I wake up every day really happy that this is where I'm coming. I feel like the training is phenomenal, the people are phenomenal. I'm gonna be sad when it's over.